Welcome to Toledo Clinic TV. Our guest for this segment is here to talk about chronic disease management. And Dr. Adil, thank you for joining us. It is really important in this country to not just take care of patients when they are acutely ill, but to manage their conditions past that, correct?
That's very correct. And I'm glad you bring that up because within the US, we've done a lot of good work focusing on acute care management. And that is when we see lives being saved. We see times being reduced for acute and emergent need or acute and emergent times shortening with access to care, whether people are on the streets or if they're in their homes. But there's been a lot of challenges, a big challenge managing chronic diseases within our country. And that is one of the reasons that we within the Western healthcare systems in the US are way down the list. I believe out of the 32 health systems that were evaluated within the last few years, we were down close to 29. So we spend a lot of money on healthcare. We spend a lot of resources, but as far as quality metrics, including infant mortality, maternal mortality, longevity, and a lot of other quality metrics, we don't make it very well. And the reason is that as we're going through our life and develop chronic conditions, those are not being managed well. I feel that's where primary care physician's role comes through, and we need to make sure that we put in our resources where they are intended to be kept.
So when we're talking about chronic diseases, these are things like diabetes or asthma or what else? COPD.
That is very true. Diabetes, hypertension, hyperlipidemia, a lot of these then lead to heart diseases, stroke, other things associated with weight management and obesity. A lot of those then leading to arthritis, osteoarthritis, different forms of cancers, asthma, COPD, associated with other conditions like smoking. You don't necessarily have to smoke to get a lot of these conditions. There could still be other environmental factors or internal factors that could lead to many of these conditions also. But really, it starts off with recognizing a lot of those conditions. It starts off with recognizing who would be at risk. So having a risk stratification for each individual, and then to see how much effort needs to be put in to prevent many of those, and if at all someone has them, then how to manage them over time. Now, that starts with going to your family doctor first. And unfortunately, there's been a high percent of people who've not had family physicians to begin with. And once they did, there's again a lot of problem with not understanding why they need to go there, why they need to follow up, what would be needed with different kinds of workups. So for that reason, there's a lot of awareness that needs to be disseminated and spread into our community and the rest of the nation about assuring that people establish care with the family physician and then provide their history well enough so that it is determined that whatever their healthcare needs are, that they are met appropriately.
The goal, of course, would be to prevent those diseases by doing that workup that you mentioned.
Yes.
But if you get to the point where you can't prevent it and a patient comes to you and is already having issues, how important is it that they are complying with you and that you're working together as a team?
Absolutely. It's extremely important for every individual to understand what conditions they have. So then for them to be open about asking questions from their healthcare providers about what else do they need to do with their lifestyle? What do they need to do with their diet, activity, exercise? What else do they need to do within the environment that could help control that? For them to be vested into their own care and ultimately assure that all those things are treated earlier on rather than having more and more complexity about that. So yes, as you said, it's important for us to take responsibility ourselves for our own health and hence talk to our healthcare providers and make sure that whatever would need to be done, it is done to the best of their capability, but it is done as a team. There could be several members of that team, the patient and the primary care doctor to start off, but the rest of the family gets involved in that. Friends, extended family, work, and then other subspecialists, your physical therapist, your trainer, your nutritionist. So there are a lot of other services and ancillary services that could be part of the team who would ultimately help take care of an individual best.
So really it's about having those relationships that will help the patient get better ultimately.
Absolutely.
Yeah. Okay, thank you so much for joining us.
Thank you.
All right, we'll be right back.